Hello everyone, in this video, I'm going to talk about all you need to know for the PLAB 2 exam. Before I start, if you haven't watched the PLAB 1 exam video, I'd advise that you go back and watch that first and then continue from here. This video will cover an overview of the PLAB 2 exam, the marking scheme, academies, exam resources, and the results, among others. Welcome back to my channel, Dr. May's Corner. If you're new here, I want to welcome you especially. If you're a returning subscriber, thanks for coming back to watch my videos. Don't forget to like and share, and if you've not subscribed, please hit the subscribe button. So what is the PLAB 2 exam? PLAB 2 is an objective, structured clinical exam, also known as an OSCE. It is taken after successful completion of the PLAB 1 exam. The exam is made up of 16 stations, in which candidates are given 8 minutes for each station, with rest stations in between. The exam covers everything a UK-trained doctor might expect to see during the Foundation Year 2 rotation. Candidates are also expected to meet or exceed the pass mark and as well pass a minimum of 10 stations. Please note that the exam procedures and marking scheme varies from time to time without notice. There are 2 assessment centres, and these are located in Manchester, precisely at the number 3 Hardman Square. So this exam is organised all year round, therefore there are many seats available as compared to PLAB 1, which is organised at specific times during the year. During the exam, candidates are marked against 3 areas or domains for each scenario. The first domain is data gathering and assessment skills. What this domain covers is history taking, physical examination, practical procedures, investigations leading to a diagnosis. The second domain is clinical management skills. This domain covers formulating a diagnosis, explaining to the patient, formulating a management plan. Third domain is interpersonal skills, also known as IPS. This covers how candidates approach the station, whether they have established a rapport with the patient, how they use open and closed questioning, how they involve the patient, and demonstrating professionalism and understanding of ethical principles. So the examiner assesses candidates' competencies across these domains. Examiners assess candidates' competencies across a number of skill areas as well. These include 1. Clinical examination. With this, the examiner will assess the ability of candidates to conduct a physical examination of a simulated patient. The GMC expects candidates to be able to carry out any basic physical examination, such as examination of the abdomen, breast, chest, hand, heart, and joints. Candidates may be asked to perform a rectal or bimanual vaginal examination. Candidates must be able to use the appropriate equipment in carrying out an examination of the ear, eye, or nervous system. They may be required to perform examination or other procedure on a high-fidelity simulator, also called the SimMan or SimWoman, which can be programmed to show normal and abnormal clinical signs. A role player may speak from outside the room using a microphone connected to the simulator. Examination of someone's mental state is a form of clinical examination, also for the purpose of the PLAB 2 exam. Following this is practical skills. Examiners will assess candidates on their ability to perform common practical procedures. These practical skills may include checking blood pressure, performing venipuncture, inserting a cannula into a peripheral vein, calculating drug doses, giving intravenous injections. Thirdly, interpersonal skills. The General Medical Council, GMC, tests these skills by observing the interaction between candidates and the other person. The examiner will assess the approach of the candidate to the patient all through the examination. This may include explaining diagnosis, investigation, and treatment, involving the patient in decision-making, communicating with relatives and healthcare professionals, breaking bad news, seeking informed consent or clarification for an invasive procedure or obtaining consent for a postmortem, dealing with anxious patients or relatives. In preparing for this exam, some people may decide to prepare individually, others also opt for PLAB academies. So if you're interested in PLAB academies, I would urge you to search on Google PLAB academies in the UK. These are organized privately by various individuals for candidates, taking them through the 3 domains and all other things they need to know for the exam. Some academies also organize mock examinations so that candidates get acquainted with the nature of the exam. Next, I'm going to talk about resources that the General Medical Council itself offers candidates preparing for the exam. If you've not liked or shared, I would urge you to do so at this point. So the General Medical Council, GMC, offers some free resources for this PLAB exam. These include a sample OSCE station, PLAB 2 sample drug card, sample adult and child intravenous fluid chart, daily fluid balance chart, prescription chart, blood prescription and administration charts. All links to this are in the description below. It also provides the PLAB blueprint, which covers all topics in the curriculum. On the day of the exam, most of the stations will involve a simulated patient. Candidates are expected to interact with the actor as they would a real patient, including requesting to perform any relevant clinical examinations. Candidates are expected to begin each station by confirming their name and GMC number. This is important as the examiner may not always be present in the room and may be watching remotely. In some rooms, candidates will find a telephone or video call stations. The call will be connected for candidates before they enter the room, and the GMC advises that it is important candidates do not touch the phone or monitor as this may disconnect their call. In some stations, candidates will be assessed on their ability to conduct a physical examination of the simulated patient using a model or a mannequin. So right after the exam, the GMC would usually let candidates know when results will be released. This is usually after about 4 weeks of the exam. This is a sample quantitative result obtained from the GMC website. As seen on the screen, all the stations will be outlined in the results card. The scores for all the domains for the respective stations will be stated. The total score and the pass score needed for each station, which you should note varies for every station, would be stated. Then the outcome for each station, which is either a pass or a fail, will be stated. Next, I'll be talking about the qualitative results. The qualitative results highlights how a candidate fared in consultation, making a diagnosis, examination, findings, issues, language, listening skills, management skills, rapport, and time management. After candidates have successfully passed the PLAB 2 exam, they would be allowed to register with the General Medical Council. This would give them the opportunity to obtain a certificate and a license to practice. Candidates will then be able to apply for jobs in the UK. Please note that I have videos offering a step-by-step guide to finding medical doctor jobs in the government, that is the NHS sector, and the private sector. So please watch this to familiarize yourself with the application processes. This brings me to the end of the video on PLAB 2 exam. If you haven't liked, shared, or subscribed, please do so, as this would encourage me to come up with more informative videos. Note that I have videos on a step-by-step guide to finding medical doctor jobs in the public or NHS sector, as well as the private sector. If you haven't watched it, I believe that it would be helpful. Thank you very much for watching. If you're yet to take the exam, I wish you the very best. Let us know how it goes in the comment section. Bye!